Hello everyone, we are from DCare or Dementia Care team. We will present about our project. And this our team consists of 6 people from different university. And let me tell you about our story. I've lived with my grandma since I was born. When I was child, she was a loving and caring person. But then she started to forget little things, like where she put her things or forgot what she wanted to say. And she also frequently had mood swings. At first, I thought it was just a normal things that will happen to elderly people. But as time went by, my grandma just suffered more than she did before. One day, she went out and was gone for 3 days. My family and I were so panicked because we couldn't find her anywhere. Then, one of my neighbors called my dad and told us that he found my grandma in a place that was far from our home, and she forgot where she lived and her relatives' names. After this incident, we knew that our grandma had dementia.
Have you ever heard of dementia? Or maybe someone in your family has dementia? And what exactly is dementia? In short, dementia is a cognitive dysfunction that worsens over time. This disorder causes impairments in the affected person's daily life, both physically and mentally. And that's not just our grandma, but in 3 seconds, one person in the world has dementia. According to World Health Organization, around 50 million people have dementia, and every year there are nearly 10 million new cases found. And in Indonesia itself, there were 1.2 million cases occurred in 2016, and the number will double up every 20 years. And 68 of the increase will occur in low and middle income countries. While the cost of dementia care is very expensive. Then this becomes the reason for 61% people who living with dementia, they live in their own home without a proper treatment. But why did this happen? This mainly happened by the lack of knowledge and the unavailability of informative and educational media about dementia by the families or caregivers in recognizing the early symptoms of dementia, such as memory loss, which is considered normal as the patients get older. Based on the background and causes found, we give three problem statements. They are how to provide a large-scale solution of supporting dementia patients' life with affordable cost. How can we give right support of care with proper knowledge of dementia? And the last is how to ease the patient to be able to do early detection of dementia.
This is our solution. DCARE, stand for Dementia Care, is an application to support at-home caregiver to improve the quality of dementia patient life with a benefit early detection of dementia by machine learning, and then it can self-monitoring, keep in touch with professional, and also can get low price. So, why dementia care? With DCARE, we can do early detection anytime, anywhere with a 5-minute test. It's not only the body that needs to be maintained, but also the memory. Let's keep our minds and memories healthy with DCARE. This is a comparison with their competitor. Most of similar applications just give information and monitoring feature, but with DCARE, we can solve early detection by machine learning with 90% accuracy. That makes DCARE really a one-stop support solution for dementia care.
Therefore, we conclude that these are our features: login, halaman beranda, deteksi dini, jadwal kegiatan, olahraga, artikel, data diri, and panduan aplikasi. For the login feature, we implement file-based Google Sign-in authentication to each our users so that they don't need to register anymore and just use their existing Google account. So this is our homepage and article feature. For the article feature, we provide an information about dementia. So this is our early detection feature called Deteksi Dini. This feature contains an information page that provides an information about what users need to know before start the early detection. An instruction page that provides an instruction about what users need to do. And then the personal data page. In this page, users need to fill out their personal information. And then the MMC screening test. We implemented MMC screening into our app so users can do the test with their mobile phone instead of going to hospital. And then the validator page is like an official MMC screening. We have a correct MMC score. Our apps provide a validator page so the validator can do the validation regarding password answer. And for the last is prediction page. Here we are with our magic feature. In this page, user can do the prediction whether the user is suffering from dementia or not. Not only that, the care will improve the patient quality of life through these features, jadwal kegiatan, and olahraga features. Jadwal kegiatan will help user to schedule their daily activities like exercises, take medicine, and reading articles, and also provide a reminder for each activity so that the user won't miss their scheduled activities. And then olahraga feature will provide a guidance to do some basic yoga exercises.
For creating the early screening feature, we use machine learning model with sequential model classifier on TensorFlow. By creating the model, we can tell that a patient probability of dementia by using their information. For the dataset itself, we use the Kaggle dataset that's maintained by Jacob Boyson and published by Washington University Alzheimer's Disease Research Center. And with this dataset, they have two methods of data collection that use cross-sectional data and then longitudinal data. In our model, we combine all of these methods with some columns such as gender, hand, age, education level, socioeconomic status, MSE result, CDR, total intracranial volume, and brain volume. And then for the baseline implementation, actually we need some medical records such as whole brain volume and then total intracranial volume, but in our implementation, we remove that because we need the model to be used by the third user. So we need the model as handy as possible. So we create the model by using the TensorFlow sequential classifier model with three hidden layer and then one output layer with ReLU and softmax as our activation function. And then we use Adam optimizer with binary cross entropy as our loss counter. With this model, we reach 91% of accuracy. This is our prediction result that have good result, and then this is our implementation on Android on your screen.
So, we plan to implement our app in nearby hospital, especially in Palembang City, and this is the example of mini mental state examination or MMSE that we refer in our app, where there is an assessment to score how much the MMSE that the patient has, where 24 until 30 categories as no cognitive impairment, and 18 to 23 as mild cognitive impairment, and 0 to 17 as severe cognitive impairment. And there was 3 stages where indicate there need to be treated at on health facility, like on the first level, second level, or the worst one is the third level. And then this is our documentation for our project, and this is our backend service. We use like Google Cloud environment for the cloud services. We use Flash and Python as our backend, and we put where we put our ML model. And this is for the Android one, we use Kotlin base, and for the machine learning one, we use open dataset like OASIS, Open Series of Imaging Studies.
Our target market is low to middle income family that prefer at-home treatment. We target family that focusing on facilitating patients' life support and care and have minimal safety concern. And then for our market size, we have 1 trillion worldwide dementia cost care, and will be doubled on 2030 as I suppose, and Indonesia itself has 70 million market share. For our initial product, we target 4 million market share. And for our revenue stream, we will take it from commissions. We take 15% commission on each transaction on medical consultation, caregiver provider, and medicine sales. If we get the funding, we expect a runway for 6 months where we get 5K funding. And if we get 10K funding, we will have 1 full year runway with 10 staff and more strength business. That's all from our group. Thank you.